AMA guides have started to include what are called diagnostic related estimates with the range of motion method. So there's two different methods here. What the diagnostic methods are, it's somewhat of an easier way to give impairment rating. And what they've done is they've listed about 8 different categories for the regions of the spine that you can just go into. That's more cookie cutter, shall we say, that you can go into if the patient has the history, the signs and the symptoms, and it matches with that pathology, then it'll automatically take you to an impairment rating. So that's kind of a real cookie cutter, but obviously the guides can't include every perceptible injury in the world. That's why they're called guides. So some of the impairment ratings will be straight on. You'll know your diagnosis, and that's where to find the impairment rating. But that's far and few between. As an example, like in the neck, for the in the neck there's 6 objective findings for neck injuries, 6. Only 2 of them are directly in the book and give a number. The other 2 you have to use the guides to get to. So anyway, some of the categories to pay attention to with the diagnostic related estimates. And by the way, the guides does say, and this is interesting, it says, if it's due to an injury, an accident, trauma, the preference is to use the DRE models. That's what it says. But it says if you cannot find the appropriate information in the DRE models, then you want to use the range of motion method. And you can use both. So essentially it's fair game. So they're giving you an order, and then who are the people who can give impairment guides or impairment ratings? Well, a physician. It specifically states in the guides it's a physician function, a doctor function. It is not an administrative function. A disability is an administrative function. An impairment is a physician function. So that's who should be giving impairment ratings.